All right, good morning, everybody. Good morning, members of the committee, those in the audience and those joining us via Zoom. Welcome to House Labor, Health and Social Services Committee. Mr. Caldwell, I'll call the meeting to order, and if you would take the roll.
Representative Clouston.
Here.
Representative Guggenmoss.
Here.
Representative Heft. Representative McCann.
Here.
Representative Ottman.
Here.
Representative Stivar. Representative Wasserberger.
Here.
Representative Yen. Chairman Rodriguez-Williams. We have a quorum.
Thank you, Mr. Caldwell. So good morning. If you did not see our opening, or our committee rules and guidelines out front of the committee room, there are some if you'd like to follow along, but I'll briefly go through them really quick for us. Members and of the committee, please remember to keep your cell phones on silent and those in the audience. Although it may seem an awkward formality, speakers will address the committee or the comments and questions to the chairman, not to individual committee members or to others in attendance. This helps us avoid personalities and comments of a personal nature. All comments will be directed to the issue under discussion by the committee. Distracting comments or on unrelated side issues are out of order. Speakers will avoid personal criticism, ridicule, or name-calling directed at anyone else in attendance at the meeting. This includes comments of a personal nature directed at any other speakers, audience members, or members of the committee. For audience members, we expect that you'll refrain from any behavior that disrupts the orderly conduct of our meeting. Specifically, the rules prohibit speaking when any other person is talking, carrying on loud and distracting side conversations, no shouting, clapping, wooing, booing in response to a speaker's comments. Our general guideline is very simple. We just ask that everybody conducts themselves in a civil and respectful manner at all times during the meeting. So, committee, we have two bills on the agenda this morning. We have our Senate File 113, and then we have Senate File 74. I will put Senate File 113 on the table for the committee's consideration. This bill is titled Greater Opportunity Act, and it's sponsored by Senator Hutchings. Good morning, Senator. Welcome. If you would come forward. Do you have a co-presenter with you? Okay.
Madam Chair, members of the meeting, thank you. Senator Lynn Hutchins. 113.
Senator Hutchings, can you confirm your mic is on?
Yes.
It is.
Move the closer to me.
Thank you,
How's
ma'am.
that?
Yep.
Does sound a little bit better.
Yep,
And
tell
I
us
have-
about your bill.
And I have Miss Lolly Gunn. She's the cosmetologist that brought this bill to me. And I've got to tell you, this is one bill I am really, really, really proud of. Outside of homicide amendments, this one is short, sweet, but it's gonna do a lot for Wyoming, okay? This bill is an act relating to professions and occupations specifying that the practice of natural hair braiding is exempt from the Wyoming Cosmetology Act. And we're clarifying that the owner of a salon may require certification for that person who's braiding the natural hair, and we're making some conforming amendments. So far, 35 states have done this, and we're hoping that Wyoming will be the 36th. We're the first, we were told, to go to the cosmetology board and just say, hey, can you help us groom this bill? They can't be yay or nay, but we asked them to help us, and they did give us a couple suggestions. This is a jobs creation bill. By its passage, we'll have at least 4 wins for everyone. The braider is given a job to help support their family. Once hired and working for a licensed cosmetologist, they could possibly see what it's like to be involved in becoming a cosmetologist and go to cosmetology school and spend the thousands of dollars needed. It adds another taxpayer to our rolls. We like money. It opens the market for more braiders, which means we do not have to go to other states and spend our money our time there and get the job done, we can keep our money here in Wyoming. Wyoming is a pro-career training and education promoter. What better way to do this than to open this up? So what goes on with the bill is, is natural braiding of hair. You've seen the sports guys with cornrows, you've seen people with the longer braids. That's natural braiding for us. And it's right now in the cosmetology section of our statutes, and we want to exempt it out as you have to go to cosmetology school to do this, because most of us naturally know how to do it. I can't say us because I never learned how to braid. We had an aunt that did hair. But by exempting this out, it'll open the door for someone to come work with in a salon and, like I say, hopefully become a cosmetologist. There was something in my mind and I just slipped out. Let me see if I can get it back. Oh, the number one thing here that we found is that here in Wyoming, when you go to get a cosmetology license, they don't teach you how to braid. So you're getting a license pretty much for nothing if all you want to do is braid. So on page 2, we go through the things as using this act, what we have our definitions, what braiding is, the practice of braiding, what it means, and then simply on page 3, we exempt that out. Now, if there's any amendments, Madam Chair, that one of our representatives who likes to amend bills would like to bring, I would like him to make this effective immediately. And with that, Madam Chair, I sit for questions.
Thank you, Senator. Committee, any questions of Senator Hutchings about the bill?
Excuse me.
Representative Heft.
Thank you, Madam Chairwoman. I'm curious if on what your thoughts would be on requiring the braiding to be solely done in, like a studio or rather than independence. I'm just curious if there would be a preference to that, and you might have some comments on which way you'd like that to be seen.
Senator Hutchings.
Madam Chair, Representative Hoft, am I pronouncing that correctly? Okay, thank you. Heft. There we go. My preference would be in a salon. I've had my hair braided. I'm 64 years old, most of my life in some form or another. And I think in the salon, you get a professional treatment. Going to Mrs. Gunn's shop, you just know you're gonna get it done by a professional, or having her oversee that braider, I think is a good idea, because you can always go anywhere you want right now. If I wanted to go sit in your basement to get my hair done, and I've done that, and the shops are always better. Thank you.
Further questions of Senator Hutchings or her co-sponsor or co-presenter? Representative Klauston.
Thank you, Madam Chair. Thank you, Senator, for bringing this. And just a question, I've seen hair braiding done like Cheyenne Frontier Days or some of the other places around the state. Would this eliminate that ability to do that, or would people still be able to do natural hair braiding at events or anywhere else?
Senator Hutchings.
Chairman Rodriguez-Williams, that is an interesting question. I've never seen people do it at Frontier Days. Never heard of that. Is it just braiding? That's interesting. I don't see this preventing that at all.
Thank you. Representative Wasserberger.
I guess to follow up, I would imagine it wouldn't probably do that because, my wife's sister braids her hair all the time, and I think that's just, for her and her sister, it's kind of a natural instinct to work on braiding hair because, for those purposes. But Senator Hutchings, I was just curious, do you know how much it currently costs to get licenses for hair braiding here in Wyoming?
Senator Hutchings, are your co-presenter?
Do you want to answer? Since you're up here, I'll let you answer.
Hi, good morning. Thank you. Madam Chairman and Representative Wasserberger? Wasserberger, okay. As far as cosmetology school is concerned, I'm pretty sure, now don't quote me on this as far as the number is concerned, but it's definitely more than 15 grand under 20,000 to go to cosmetology school or to achieve a hairstyling license, which is what I have. I decided to just stick with the hairstyling portion of the cosmetology program because the cosmetology program, of course, includes hair, skin, and nails. And I was only interested in the hair portion of the curriculum. So as far as that is concerned, I think that just the price of the school alone and having to come forth with that, whether you have FAFSA or loans or whatever, and then not be taught exactly what you plan on doing in the salons or as a career, yeah, it definitely is troublesome for a lot of people.
Thank you. Further questions from the committee for the bill sponsors? Representative McCann.
Thank you, Madam Chair. Senator Hudgens, just page 3, line 9 and 10. I'm just worried about that wording. It just seems backwards to me, or like a double negative. This act shall not apply to a person solely engaged in practice of natural hair braiding. Does that mean if someone's just doing that, the way I read it, maybe it's just my mind. I just want to make sure we got the wording right, and the fact that if that's the only thing they do, this isn't going to affect them, correct?
Senator Hutchings.
Chairman Rodriguez-Williams, Representative McCann, what it's saying is that this person, that's all they're gonna do, is
Okay.
solely braid hair. They're not
Okay.
gonna wash hair, they're not gonna curl hair, they're gonna braid hair. And some people, they love just braiding hair.
And I'm for all of this. I just want to make
Yes,
sure
that's-
that not apply. I'm like, okay.
This shall
this is
not
one of
apply.
those-
Yeah. That's the way, Madam Chair, Representative McCann, that's the way the LSO phrased it.
Okay.
But I will, if this bill does pass through, go up and make sure.
Yeah, I just want,
'Cause that's-
yeah, because to
I
me,
see
that
where
makes it
you're
sound like
thinking.
they're not
Not-
involved.
Right,
Does that
gotcha.
make sense?
Gotcha. I'll have,
Just, I would double check that, please.
I will,
Thank you.
and get an answer to the committee.
Thank you. Further questions? Vice Chair Ottman.
Thank you, Madam Chair. Senator, thank you for being here. This is just a point of clarification. On page 1, line 4, starting at line 3, it says clarifying that the owner of a salon may require certification for the practice. And then again on page 3, lines 16 and 17, nothing prohibits the owner of a salon from requiring private certification. Where would a person even get this private certification?
That's a good question. If you
Senator Hutchings or forgive me, your last name?
Gunn.
Gunn, Ms. Gunn.
Thank you. Thank you, Chairman Rodriguez-Williams and Representative Ottoman.
Ottman.
Oddman, okay. So for this particularly, when we say classifications or specifications or even a certification, it could be in response to like bloodborne pathogens, being able to understand how to properly disinfect your implements. And that's where it kind of falls under the net of having the braider work underneath a salon or with a person who has been certified in cosmetology. Because that safety net we did go through the school, so we do understand the importance of the sanitation and disinfection and being able to identify certain things on the scalp that they may not be familiar with. So in reference to it saying the owner of a salon may require, there are 30-hour courses. There are a couple-hour courses that you can take online that would allow you to be certified in sanitation, disinfection, in bloodborne pathogens, in any kind of disinfection or client, so I guess it would be client protection, you know what I mean? That doesn't require a cosmetology license, that the salon owner may feel more comfortable with the braider taking.
Follow-up, Vice Chair Ottman.
Thank you, Madam Chairman. So as the owner of a salon, would it be more often that you would require that for protection or just, for the skill set and for the knowledge? Should that be required, or should it be left at the discretion of the owner? Is that something that braiders on their own even know about? I mean, and not to cause a problem, but just to ask.
Absolutely.
Ms. Gunn?
Oh, sorry, I apologize. Chairman Rodriguez Williams and Representative Ottoman. So I personally feel that, yes, I think it should be something that would be highly recommended. Because if you are unable to identify what to do if you see an open sore on a scalp, or understand the common sense, which is not obviously common, but which we would hope would be something as you're not using the same comb on every single client. Those kind of things are things that we would hope that a salon owner would address to the braider, because that kind of knowledge, we can't just assume that they know. So I think we presented this with the hopes that the salon owners would want to require that kind of certification, that kind of further education for that specific person, without the hindrance of the expense of a whole 1,500-hour cosmetology school, rather than maybe like a $30 cost out of pocket, for a 30-hour course or something like that, to that nature. I know that it has been said that there's a possibility that on the cosmetology website, they might have something that would direct salon owners to say, there is a course available on this website, the Board of Cosmetology, even though it's not regulated. Maybe we'll be able to, provide like a link for somebody, or easier for someone to be able to have access to those courses. You're welcome.
Committee, any further questions of the bill sponsor? Representative Yin.
Madam Chairman, thank you. Senator Hutchings, and maybe Ms. Gunn, if you want. I'm curious on why the route for complete deregulation. So it looks like some states have a separate hair braiding licensure that's kind of pretty simple, where they require an exam to ensure that they have standard sanitation knowledge. I'm leaning on the side of complete deregulation. I think it's, for a state like Wyoming, it's probably pretty fine. I'm just curious on why you picked this route instead of something like a separate licensure.
Senator Hutchings.
Thank you, Chairman Rodriguez Williams, Representative Yan. Deregulation is just so important for something that's so natural, that we just do naturally. Most states are trying to get this through, to totally deregulate natural hair braiding. Thank you.
Further questions of the bill sponsor? Okay, seeing none, thank you. Senator.
No.
Okay. Thank you both. Don't go far. We'll go ahead and open it up for public comment. Are there any government agencies that would like to testify on House Bill 113? Okay, seeing none. Any members of the public that would like to come forward? We've got 3 chairs here, so if you want to show your support or opposition for the bill, you're welcome to come up. Okay. Yes, please. Oh, please don't. You're okay. Just state your name and we'll hear your testimony. Yeah.
Okay, thank you. There are so many people that utilize braid services for various reasons. And until Lolly opened up her shop, there wasn't anyone here doing it. We have a large number of customers that come to us that live here, that make money here, that used to go into Colorado. So they're making their money here, and they're driving into Colorado, spending their money that they made here. And I want you to understand that it's not 20 people. It's not 50. We're talking a few hundred people who are now making their money in Cheyenne and spending it in Cheyenne. And I just wanted that to be said. Thank you.
Thank you. Any other public comment? Okay. Seeing none, do we have anybody online? We do have somebody online. Okay. Please bring them in. Good morning, welcome. If you can turn on your camera and unmute yourself, welcome. Please state your name, who you're with, and we'll hear your take on the bill.
Thank you, Chairman Rodriguez Williams. My name is Sophie Mars, and I'm with the Institute for Justice. We are a nonprofit public interest law firm that works to protect civil liberties, including the right to pursue the occupation of one's choosing. And I had hoped to be there in person today to testify, but had to change my plans yesterday due to weather. So thank you for still allowing me to testify remotely. We are in support of this bill, and Senator Hutchings and Ms. Gunn have emphasized the job creation opportunities that the bill provides for, but I would like to emphasize the safety component. A few numbers to support my testimony. Wyoming is one of only 3 U.S. states that still require hair braiders to obtain a full cosmetology or hairstyling license. By contrast, 35 states fully exempt hair braiders from licensure, and the remaining 13 states require a specialty license to braid hair. But what's interesting is that the trend is actually towards deregulation of even specialty licenses. Specialty licenses were originally passed as a carve-out for hair braiders because full cosmetology licenses, such as Wyoming's, were considered burdensome and unnecessary, but even specialty licenses are now being considered unnecessary. Ohio and Pennsylvania exempted hair braiders from licensure within the last few months, and an Illinois task force recently recommended the same position. I'll also note that the 3 states that, including Wyoming, that currently require braiders to obtain a full license, have all introduced legislation this session that would fully exempt hair braiders from licensure. So what these states are realizing is that hair braiding is safe. It is a manual, natural, and chemical-free art form. The Illinois task force that I mentioned actually said the requirement for hair braiders to obtain a license is unnecessary as there is no public safety concern when individuals braid hair, and requiring a license for hair braiders does not enhance public safety, but it disproportionately impacts individuals from minority communities. Being a hair braider ought to be thought of like being a chef. Many chefs are self-taught, but they don't need to go to culinary school nor be licensed by the state in order to provide food for customers. They also have a professional incentive to keep their workspaces clean and their customers happy. Braiders are no different. And yet in the state of Wyoming, a braider has to train for double the amount of time as a pharmacy technician and 4 times the amount of time as an emergency medical technician. And this bill would correct that disparity. So as there's no demonstrated public health and safety advantage to higher barriers of entry for an occupation, it's worth considering why those barriers to entry exist at all. So I thank the committee for considering that question today, and I welcome any questions that you may have.
Thank you, Ms. Mars. Committee, any questions of Ms. Mars? Okay, seeing none, thank you so much for joining us this morning.
Thank you.
All right. Anybody else in the audience want to testify? Any registered lobbyists? Further members of the public? Seeing none? Okay, I'm going to close public comment. Senator Hutchings, come on up. Looks like you have something to say.
Madam Chair, just one more comment on the effective date. I meant that.
Yep.
If you can, I'd like that.
Okay, so public comment is closed. Committee, what is your pleasure on Senate File 113? Bill's been moved by Representative McCann, seconded by Representative Gugemas.
Can I make the motion to move the amendment? I would make the.
Oh. Yep, so, okay, so the bill's been moved and seconded. Seeing ambition from the committee, we're gonna go ahead and work this bill. So at this point, we'll discuss the bill, and committee, if you have any proposed amendments, this would be the time. So Representative Wasserberger.
Madam Chair, thank you. I love deregulating, as you can tell. Can I please make move the amendment to make the effective date immediately upon signing into law?
Okay, Representative Wasserberger has proposed amendment to make it, the bill effective immediately. It's been seconded by Representative Yen. Discussion on the amendment. Seeing no discussion and the ambition to vote, but Representative Yen has called the question. So through a voice vote and a show of hands, all those in favor of Representative Wasserberger's amendment, please state aye.
Aye.
Aye. All those opposed? Seeing none, the amendment has passed. Mr. Caldwell, you have that? Okay. Further amendments or discussion on the bill, committee? Okay. Seeing none further, Mr. Caldwell, if you'd call the roll on Senate File 113.
This is a roll call vote for Senate File 113 as amended. Representative Clausen.
Aye.
Representative Guggenmoss.
Aye.
Representative Heft.
Aye.
Representative McCann. Representative Ottman.
Aye.
Representative Stivar. Representative Wasserberger.
Aye.
Representative Yen.
Aye.
Chairman Rodriguez Williams. Madam Chairman, that is 8 aye and 1 excused.
Thank you, Mr. Caldwell. So Senate File 113 has passed committee. Senator Hutchings, if you would choose somebody to run your bill on the House floor, that would be great. And thank you to you and your co-presenters for joining us this morning. Okay, committee, we will move on to Senate File 74. Immunity for drug overdose reporting. This bill was sponsored by Joint Labor Health during the interim and is now on the table for the committee's consideration. All right, committee. Representative Yen is going to walk us through the bill, and then we'll move forward with further information on it. So Representative Yen.
Madam Chairman, my apologies, so give me a second while I get my stuff sorted. Members, this is a committee bill from the interim. It is about making sure that if someone is having a drug overdose event, that there is a little bit of essentially a Good Samaritan immunity to help that person out, right? So I think situations that could happen are that someone is at a party, they have a drug overdose, someone who should not be at that party because they are doing whatever, worried, we want to make sure that the number one priority is to actually get that person help. And so that's what the bill intends to solve. It's, a pretty long bill. I actually haven't checked what the senators did to it because it is a blue copy, as you see. So I might leave that to the other co-presenters that are at the table right now. But it was brought to us by constituents to make sure that we can help people when they are in need. And not we, but the public doesn't feel scared to get help for people when they are in need.
Thank you, Representative Yen. So committee, we do have some co-sponsors here with us, or co-presenters here with us today. So please state your name, and if you'd like to help walk us through the bill, that would be great.
Madam Chairwoman, Lindsay Simoneau with the Wyoming Behavioral Health Alliance. Andy Somerville with WAMSAC, the Wyoming Association for Mental Health and Substance Use Centers, was not able to be here this morning due to the weather. And so I am commenting on behalf of both of us. As the Wyoming legislature knows, we have had an opioid problem in all 23 counties for many years. Wyoming is the only state that does not have this type of legislation in its books, in its statutes, that allows for protections for somebody who is calling with the hopes of saving someone's life who is experiencing an overdose. And what we heard on the other side of the legislature from our students in Laramie, who are also trapped in the snow and currently, is that it does prevent people who may be in legally compromising situations from saving lives. And ultimately, the reason that we went into this line of work is to save lives, regardless of what may be happening in that situation. And so we want people to get to life-saving care as quickly as possible. We recognize that time is of the essence. So any barriers that we can eliminate to encourage that help is incredibly beneficial. And it's a good little bill. So far, good. We love that. We love good little bills this session. As far as everybody being, all the stakeholders being on board, the Wyoming Association of Sheriffs and Police Officers is on board, mental health providers, the community mental health centers, and then I will also let Dr. Vaughn speak to her expertise because she has great insight to this bill as well.
Dr. Vaughn, welcome.
Good morning. I'm actually recently married, so I'm Dr. Angela Farrand, and I'm the chair of the Wyoming Naloxone Project. I was one of the people on the committee who helped draft this bill, and I know that as far as the Senate goes, and that was a question, they did put some amendments in as far as how many times you would get immunity for calling 911. There is once you get absolute immunity, and then the second time, I think that there is a provision that you would have to get into treatment, which there's a lot of different logistics that weren't discussed with that. So that is something that we don't see in other states, but that's what changes were made in the Senate for that.
Thank you. Committee, any questions for our co-presenters? Representative Yin.
Madam Chairman, just for the edification of the committee, the changes on page 4, lines 5, the starting of that new sentence to the end of the paragraph is the change that the Senate made. So just as the doctor said, it is about making sure that someone can't abuse this, right? Like that, I think that was the intent of the amenders, regardless of the logistics, is that to get immunity for the second time. So if you find yourself in a compromising position where you're saving someone's life again, at the very least, we're going to ask you to go to a drug treatment program. And I think that was to allay concerns of people who were worried that the bill was going to be abused.
Madam Chairwoman.
Ms. Semino.
For a point of clarification, I also believe there is a timeline on that, that I believe it's 2 times in 12 months. And then there is a reset for the reporter.
Committee, any additional questions? Representative Clauston.
Thank you, Madam Chair. And then to either one of you, do you see this amendment being a problem with this bill? Do you think it hurts the bill at all? I mean, you got to hear the discussion over there. Like, I'm just trying to think of who's going to keep track of how many times, this individual has called for help. And I understand the reason they're thinking of it. I'm just trying to figure out how it's going to actually work and if it's needed, so.
Dr. Farron or Ms. Semino?
Yeah, Madam Chair, Representative Clausen, thank you for that question. I think that as far as who would keep track of that, it would likely be law enforcement. They typically co-respond with our EMS partners on overdoses themselves, which can be quite a bit for them to keep track of. As far as the treatment provision goes, I know that there was some discussion on who would be responsible for that, especially if there would be immunity, how they would get into the court systems to go into a court-ordered treatment program. So I wouldn't say that necessarily those are problems, but those are just barriers that would likely need to be discussed further as the bill progresses.
Further questions? Representative Wasserberger.
Now, Madam Chair, thank you. Yes, thank you for coming and sharing this bill with us today. I'm just curious, what if it's somebody that is with a friend and, this person might be, probably not indulging in that stuff as much, but they have a friend who's a little bit vulnerable to these practices, and so they see their friend go down, and so they decide to call because, fortunately, there's immunity. If that person is friends with that person associated with the vulnerabilities, are they going to have immunity every time that they call to save their life? Because I'm just asking because I can think of times where, I've heard of people where a situation like that happens, somebody's overdosing, and everybody, gets out of the scene as quickly as possible because, everybody's too afraid to call in and help them. Do they only have immunity 2 times, or are they unlimited if they're just helping somebody else that's vulnerable to the overdose?
Yeah, Madam Chair, Representative Wasserberger, that's a great question. That's something that was also discussed in the Senate. So this is how they had really interpreted it, was it's the person overdosing specifically. And I think that's really up to law enforcement discretion and investigation when it comes to who is overdosing. But you're exactly right. When we review our overdoses for the county, because I chair the county overdose fatality review, we certainly see that where there's paraphernalia present and then everybody leaves, whether they're using or not, just because they are afraid of that prosecution component. So I do believe that this is specific to the person overdosing and not necessarily the person calling, but it also gives that additional layer of protection for that person calling, just so they feel comfortable enough if there is paraphernalia present to call.
Further questions? Okay, seeing none, thank you both. We will open it up for public comment. If there's any government agencies, members of the public, registered lobbyists, please come forward. Good morning. Please state your name and who you're with and your take on the bill.
Good morning, Madam Chair. My name is Alan Thompson. I'm the Executive Director of WASCOP, which is the Wyoming Association of Sheriffs and Chiefs of Police. We were consulted interim and through the legislative session on this bill heavily. Our membership understands the intent of this and would kind of like to say that this seems to be codifying what law enforcement's already doing. What we want is to make sure that people are treated quickly and specifically to what known substance might be in their system. And it is imperative that we have someone on scene to help relay that information to EMS and hospital staff. So this has quite a few of those guardrails in there. They have to be there, they have to be honest, and then it does just give them immunity from those 2 misdemeanors, possession and use of a controlled substance. And I would say that we're probably doing a lot of this in practice already. Telling somebody on the scene, listen, if you're honest with me and we get the right treatment to this person, I'm not gonna write you a ticket or take you to jail, but please be honest with me and don't say it was this item that's legal when it's really this item that's illegal. We're not worried about any of that stuff. We're worried about saving lives. So I'd be happy to answer any questions that you might have. Madam Chair, I'd like to add the component of tracking these, 2 instances in a 12-month period type of thing. I would say the vast majority of those are going to be tracked with local law enforcement, because when we have these people living in our community, we know them, we deal with them on various things in addition to any of the drug-related crimes. We know them. The vast majority of our agencies across the state are very small agencies serving a very small population. We've likely known this person since they were in diapers. Now, there's not to say that you can't have someone in Cheyenne move to Casper and then move to Sheridan and get 4 of these get out of jail free cards in a year. But the fact of the matter is someone might have gotten good treatment for that and saved a life. And I think that's fine also. So be happy to answer any questions you might have, Madam Chair.
Thank you. Committee, any questions of Mr. Thompson? Representative Wasserberger.
Madam Chair, thank you so much. Thank you for coming and testifying on this today. I heard you say that it was just for some misdemeanors. Now, what if it's for things that are a little bit more, I mean, are all drugs considered a misdemeanor at this point, or is there something that's a little bit different that's considered a felony? And are those people, if that is the case may be, do they have that immunity if that's something relating to a felony?
Madam Chair.
Mr. Thompson.
Thank you. This only applies to the two misdemeanors of possession of a controlled substance or use of a controlled substance. Those are two misdemeanors. Now, the possession of a controlled substance misdemeanor is tied specifically to low amounts of each substance. So, it's less than 3 ounces of marijuana, less than 3 grams of methamphetamine, less than 0.3 grams of liquid form. So those are all the low-level user-type possession. Now, when you get into delivery of a controlled substance or possessing a controlled substance in excess of those amounts, those felonies apply there, and they're not exempted from that. Now, that's where officer discretion comes into play. So you have two people that went in together, purchased this item, this drug, and are using it. It might be a felony amount. Are we going to pursue felony amount for that? Maybe not, but you might have a young, impressionable 17-year-old person, and you have an adult that purchases and then uses that substance to get somebody high and then takes advantage of them. There's where we're going to be looking at delivery of a controlled substance because the intent was different. Or just simply, if you're the drug dealer in this case, you're not exempt from this statute. You're not exempt from those felony statutes, excuse me. This is making sure that people that are together and recognize the overdose things, and they're just afraid that they're going to get in trouble for using in the area with this other person, or the individual themselves needs medical help and is still awake and can call and say, I think I'm overdosing. We're not going to worry about the misdemeanors, but the felonies we're going to investigate.
Mr. Thompson, can you elaborate, just to piggyback on Representative Wasserberger's question? What if there's a situation where you have a group that's using edibles with THC, and lo and behold, it's laced with fentanyl or something further? Can you elaborate a little bit more about that? Those types of situations, how this would come into play?
So Madam Chair, I'm not quite sure what elaboration you're looking for with that. Like, give an example of a party, basically. Okay, thank you. Overdoses are accidental. No one takes a substance because they want to lose control and pass out and maybe die. So a lot of times we'll have people that are getting things in other jurisdictions that they're purchasing legally in those jurisdictions, that are unregulated, that are maybe come to their possession in Wyoming via the black market. So then there's something added to it in the process. There's all various things that can be in these substances because they're just not regulated by industry that we have, like with alcohol and other things. So they think they're taking a marijuana item, and then lo and behold, it's laced with something else. Fentanyl is a big thing. There's even other drugs now that are even more powerful than fentanyl, and we're starting to see those in Wyoming. Yeah, more powerful than fentanyl, I said that. And then all of a sudden, they're afraid because they have what they thought was weed. Somebody has an adverse reaction to it, and they're afraid to call because they don't want to get everybody in trouble at the party. They don't want to get the person that's overdosing in trouble. They just want to get them treatment. So they'll drive them to an ER and like kick them out the door and then drive off. And then we have all these other things. Are they driving under the influence? Like, if I just feel that if law enforcement in conjunction with the community service providers in this realm get the message out that, listen, you can get away with a misdemeanor. You're not going to be prosecuted for a misdemeanor if we just get people the help that they need and we're truthful about it. And I think that that's what we're trying. It's in a good way for law enforcement, EMS, fire, the hospitals to all get on the same page. And the message is we're going to try and save lives and not worry about these low-level drug crimes when we're trying to get treatment.
Thank you. Further questions? Representative Yan.
Madam Chairman, thank you. So Mr. Thompson, I think in your testimony, you were talking about making sure that people are honest, and it actually helps with that. So, I mean, even though it grants immunity for these low-level crimes, you would say that it still helps an investigation if one is warranted in something deeper.
Mr. Thompson.
Yes, and I would also say that if we are, I would agree, Madam Chair, that was a correct statement, and that also, if we are moving this into the felony realm, that is good mitigating evidence that the defendant could use in court to say, yes, this is a felony, yes, I could be charged with it, but I was honest, I complied with all these things related to the misdemeanor level, and they could get consideration in those felony prosecutions for that honesty and providing help for someone whose life was in danger.
Further questions? Representative McCann.
Thank you, Madam Chair. Just a quick question, as far as pushing this information out, is it mainly going to be word of mouth? How are you going to get the information out to this group? shall we
Mr.
say?
Thompson.
Thank you.
Yeah. Madam Chair, I do think law enforcement probably is not going to have the avenues to get this information out to the target group. But I think we can do that through our partners in the treatment realm, in our jails, putting this message on some of the communication devices that we have in the jail. We can do a lot of messaging there. So just various things that are all come down to what we would consider good community-oriented policing and partnering with those other service providers that that have the more frank conversations with people that might have addiction issues. And I think that this is something we can all come together on and work to, and use the media also. We can do media blasts on it, social media, things like that.
Vice Chair Altman.
Thank you, Madam Chairman. Just a question for either of you. First question is, what is dronabinol? And second question, when these people, because it keeps talking, well, there's a couple places in here that it talks about it. Page 6, line 22, page 7, line 9. And I was like, I've never heard of that. And my second question is, when these people who are at risk and end up at a hospital or something like that, are there ever tests done to see exactly what they were on or what has caused this? And then if so, is that reported to a general place to say these things are being used or reporting? Thank you.
Mr. Thompson.
Madam Chair, page 6, line 22, that whole bottom part there, except for the red words on line 14, are existing statute. So at some point in the past, the legislature has included dronabinol in this list of items listed in Wyoming State Statute 35.7, 1018. I would hypothesize that that was a drug that was needed to be added, and it was just added separately from the list of things from there. That is not a statute change in this bill at all. That's something that existed already. And then to kind of cover the first part of your second question, what we want is honesty in the field when emergency medical technicians or maybe even a law enforcement officer with Narcan is on scene and can provide immediate treatment that might help that overdose. Now, later on in a hospital setting, they'll be testing for the blood to see exactly what's in there, and then later treatment based on that blood test. But what we're wanting in emergency response is honesty on what was taken or what was believed to be taken right away, so that we can provide that immediate life-saving steps before you get to the ER and get the long-term treatment based on the blood tests. And then I don't know if there's a tracking of that data after the fact in the medical world.
Dr. Finn.
Oh, yeah, sorry. Madam Chair, Representative Ottman, I believe that with HIPAA, we can't report substances from a patient standpoint for that, but I do know that when any type of paraphernalia or drugs are confiscated from someone, from a law enforcement perspective, those all go to the lab, and then they are doing that banking of what they're finding. So that's kind of how we found that we have carfentanil in our drug supply 100 times more potent than fentanyl here in Wyoming. So I think that is about how we get that information versus medical records. But I'm happy to clarify that afterwards, since I don't know right now. Yeah.
Any further questions of Dr. Farren or Mr. Thompson? Okay, seeing none, thank you. Okay, is there anybody else that'd like to come forward? Please, we've got 3 chairs up here. Yeah, welcome. Good morning. Please state your name and your take on the bill.
Just make sure check. My name is Bryce Jacobson. I'm here on behalf of myself. You see, I'm here in uniform, but I'm here on behalf of myself. I've been a paramedic in Wyoming for over 20 years. And one of the things that seems to be a barrier with fentanyl use in particular, or many others, is that barrier that exists with law enforcement. Unfortunately, what happens is because of the negative interactions that people with substance use have, they look at first responders in that same light. So you can't look at it just as a law enforcement side of it. You have to look at it as they not even want to seek first responder help because that is another barrier. So they would rather throw their friend off to the side than call 911. I will share a story that was shared with me with a substance user out of Gillette. He was in recovery, and it's only because what happened is he was overdosing and his friends rolled him into a carpet and threw him in a dumpster. That is the reality of what happens because there's that fear if they call 911, they're going to go to jail. And we have to put a human component to that very essence of it to understand that that is the reality of which we live in law enforcement and first response, is they are putting that barrier exists because of the laws that are in place, and with us being the only one in the nation that doesn't have that, that still exists. And by putting things like this in place, it does eliminate one of those barriers for them to call. It does take time to change the culture and for them to accept that and understand when they call. But it is something that is very vital for us to be able to provide that care, because I can't provide care if no one's calling us. I am involved with overdose fatality review with Dr. Friend, and one of the things we found is that that is a huge barrier. We found many that have died because of they'd rather stash their drugs, hide their drugs, do whatever before they call 911. And when someone's overdosing, that's the last thing we want. We don't want those time delays. We want them to get help as soon as they can, because the longer they go without breathing, the longer they're going into that overdose, the worse outcome it is.
Thank you. Any questions from the committee? Seeing none, thank you for your testimony.
Thank you.
All right, Dr. Farron, anything else you would like to add?
Please, yes. Again, Dr. Farron, and I'm speaking on behalf of the Wyoming and the National Naloxone Project. I think we've hit most of the high points of my testimony. But what I do want to just add is that beyond legislation, we ultimately want to reduce barriers for people to enter into recovery and make it so there's not as much stigma in seeking help for that. So I do think that laws like this, where people are more comfortable accessing law enforcement, EMS, healthcare providers, really do reduce those barriers and break down that stigma to encourage people to seek treatment and then ultimately long-term recovery. I work with a lot of recovery organizations, and I can say that they are absolutely changing lives, but I think that that's one thing that we haven't really discussed today that I think is really important with this bill, is how it reduces those barriers and can ultimately make that more of a trusting relationship with law enforcement, EMS, and healthcare providers.
Any questions? Committee. Okay, seeing none, I have one quick one really quick. Could you repeat the name of the drug that you said was stronger than fentanyl?
Carfentanil.
Carfentanil.
Mm-hmm.
Okay, yeah, thank you.
Yeah.
All right, committee. Mr. Caldwell, do we have anybody online? Okay, all right. Oh, further public testimony. Please come forward. Good morning.
Good morning.
Please state your name and if you're with an organization and your take on the bill.
Good morning, members of the committee. My name is Sophia Gomelski. I'm here today as the Director of Governmental Affairs for the Associated Students of the University of Wyoming, which is our student government, so representing our student body today. I apologize for being late. The roads were kind of bad, and so I didn't get to bring my gaggle of students. I did encourage them to turn around back to Laramie about 15 minutes out. But I'm here to urge for your favorable consideration for Senate File 74, the Immunity for Drug Overdose Reporting Bill. I first want to thank you to the chair for helping us coordinate a time to come talk to you. To start off and just walk you through the report that I provided you all, that I hope you have. Pages 1 through 9 are just the resolution that ASUW passed in support of the bill, and that's because the bill addresses a very critical issue for students, and we're very deeply invested in its outcome. We really strongly believe that this legislation will encourage individuals to seek help during emergency situations without the fear of legal repercussions, because by providing protections for the people that need it most and acting in good faith, we can save lives and reduce preventable harm, and hopefully promote a stronger culture of care and safety in Wyoming. We also conducted a survey to better understand how students and community members felt about the legislation and its implementation, like whether immunity should extend to the person experiencing an overdose as well. The survey was available for roughly a month, and it received over 100 responses ranging from university alumni, law enforcement, but primarily from students. The survey report is on pages 10 through 16, and I've left the survey responses completely unedited, with the exception of removing the names and emails of respondents. I would also like to add a clarification that while the charts do make it seem like the option for no to select that somebody was not in favor of the legislation, it was in fact an option. It just isn't showing up because nobody picked that option. So 100% of people that responded to our survey said that they either believe that Wyoming should adopt this legislation or they believe we should adopt this law, and also include certain underage alcohol offenses. Notably, from that survey, we found that 21% of people expressed that they have refrained from calling for help in an emergency drug or alcohol-related situation because of fear of legal repercussions. That survey also prompts people if they'd be willing to share any personal experience that they may have with the subject, and I think that you will find that portion of the survey to be the most moving piece of evidence as to why we need this legislation. As you likely already know, Wyoming is the last state in our country without any kind of Good Samaritan fatal overdose prevention laws, so the remaining portion of the memo from pages 17 to 24 are just excerpts from the Legislative Analysis and Public Policy Association, their report regarding the implementation of these laws and their variation across the country. With the exception of 5 states, these laws provide protection for both the overdose victim and the person calling for medical assistance. And further, only 6 states limit the number of times a person can receive any kind of protection. The opioid epidemic continues to devastate communities across the United States, and it represents the leading cause of preventable death. According to the Wyoming Department of Health, there have been an estimated 472 deaths due to drug overdoses between 2018 and 2022 alone. This crisis has left no county in our state untouched. And so I would urge that, we can return the bill to its original draft without any amendments, but ultimately passing this legislation will be our priority, especially for students. It's essential for the protections in this legislation to be as broad as possible so that they can remain effective in reducing overdose deaths, as they have been proven to do. So I urge you to vote yes on this critical piece of legislation, because members of the committee, the world really does need more cowboys. Thank you. I am here to answer any questions as well.
Thank you. Committee, any questions of Director Gomelski? Representative Klauston.
Thank you, Madam Chair, and thank you for being here and braving the roads to be with us again.
Yeah, thank you.
I have 2 questions for you. So the first one is, if this bill passes, how do we get the information out to our students, both at the University of Wyoming and maybe at our high schools as well?
Thank you.
Director.
Thank you. I think that's an amazing question, especially because while these laws have been proven to work, the most effective implementation is with a very broad and comprehensive education. And so without that component, they're not as effective. And so, in my opinion, making sure that this law is as simple as possible, and so just saying you should call for help, adding limitations like you can call for help once and then maybe twice if it's been a certain period of time, might just make it too confusing to teach. And so if somebody's panicked at a party or whatever the situation may be, we don't want them to be trying to Google up on their phone what the statute is if they think it counted for them last time when they called for help for somebody. I think the priority should be just encouraging people to call for help. But regardless, making sure that the university, PD, and the police across the state are very well versed in this, and just having, through word of mouth and through a comprehensive education campaign, just spreading the word as best we can. Thank you. I hope that answers your question.
Further questions? Follow-up, Representative Klauston.
Thank you, Madam Chair, and thank you again. So I just want to be clear, because I think I share the same concerns with the amendment. Did your group talk about specifically the group, or you just personally, but the 2 times, second time, we're gonna have them go through treatment? So just want to know, is that a group decision or personal?
Director.
Thank you. Yeah, so that's something that we kind of heard when it was being discussed in the interim. And so our resolution does include kind of the broad support for like sweeping Good Samaritan protections, just because as students, we recognize that it can be complicated in emergency situations, especially for young people. We just want people to be on the safe side and to prioritize calling for help. Just having that aspect of personal responsibility is what makes us as a student body and us as like a student population kind of hesitant with having any kinds of limitations on that. But something is definitely better than nothing.
Further questions? Representative Gugamas.
Thank you, Madam Chair. Are there any kind of statistics on the states that have no limits? Are they seeing any kind of abuse, like the Senate on their amendment was trying to avoid any abuse?
Director.
Thank you. That's also a really important question. So Good Samaritan laws across the country have never once been associated with any kind of increase in drug use or drug misuse. But these Good Samaritan laws have been proven to be more effective with comprehensive education. And so these data isn't necessarily there as far as that variation between states that do have limitations and those that don't. But that, I would argue, is largely because most states do not have limitations. And so that data is coming from a pool of states that are not limited in that way.
Further questions? Okay, seeing none. I have one for you, Director.
Yeah.
In the event this bill were enacted into law, do you foresee this survey being administered again to compare, using this one as a baseline, basically? Please.
Thank you. I actually think that's a great idea. That's not something that I thought of before, but maybe if we were able to implement that, on our campus and look into other campuses and actually encourage them to do the same, even outside of the state, we could have more information and data that would substantiate, especially the importance of having legislation like this. So I think that's an amazing idea. Thank you.
Yeah, further questions, committee? Okay, seeing none. Thank you, Director, for joining us this morning. You represent our university very well. Thank you. And the resolution and the information is greatly appreciated. Yeah, understandable. Please drive home safe. Any further public testimony? Seeing none, okay. Committee, I will close public comment on Senate File 74. Committee, what is your pleasure? The bill's been moved by Vice Chair Ottman and seconded by Representative Wasserberger. Discussion and amendments. Representative Clouston.
Thank you, Madam Chair. So committee, for discussion, I'm going to run an amendment. Page 3, line 22, it's section D. And it goes through page 4, line 14. So I'm going to make an amendment to, I'll move it, that we delete that section. Thinking there is just what we heard in testimony. I think it confuses the issue. Now, I agree if hopefully someone has gone through this a couple times, hopefully they're getting treatment. But I guess I don't want the message, people out there trying to determine, oh man, Johnny's already gone through this once or twice, right? Like, I think the goal for me is to help these people and save lives and not confuse the issue. So my amendment there is just to delete that and then re-letter appropriately.
Okay, we have an amendment moved and seconded by Representative Gugamas. Mr. Caldwell, do you have the amendment?
Just to clarify, the deletion is from page 3, line 22 to page 4, line 14?
Correct.
Thank you.
That's correct. Okay, discussion on the amendment. Okay, seeing none, sensing the urge to vote by a voice vote and a show of hands. All those in favor of Representative Clouston's amendment, please state aye.
Aye.
All opposed? Okay, that amendment has passed. Further amendments, further discussion. Representative McCann.
Thank you, Madam Chair. Just to explain my no vote, I think you got to put some personal responsibility in it as well. So at some point, someone's going to have to take responsibility for themselves. So that's the reason for my no vote. Thank you.
Further discussion on the bill amendments. Representative Ian.
Madam Chairman, I understand that feeling. It's understandable for sure, but I think the concern is if someone dies, they can't be held responsible at all.
Further discussion. Representative Gugamas.
Thank you, Madam Chair. I'd like to keep track of the stats on this particular issue, because if it does become an issue to where we have repeat offenders, and they are abusing it, then it's something we could look at in the future.
Further discussion? Amendments? Seeing none? Sensing the urge to vote? Mr. Caldwell, if you would call the roll on Senate File 74.
This is a roll call vote for Senate File 74 as amended. Representative Clouston.
Aye.
Representative Guggenmost.
Aye.
Representative Heft. Representative McCann. Representative Ottman.
Aye.
Representative Stivar. Representative Wasserberger.
Aye.
Representative Yen.
Aye.
Chairman Rodriguez Williams. Madam Chairman, that is 8 aye and 1 excused.
Thank you. Committee, Senate File 74 has passed. Committee, any volunteers to carry this bill on the floor? Okay, Representative Yin, and if anybody would like to help him out on the floor, that would be great. Representative McCann has volunteered. So, or Vice Chair Ottman. All right, committee, that concludes both bills that we had on the agenda for today. Our meeting is adjourned, and once again, thank you to members of the public for joining us this morning and braving the icy roads.